Hello and welcome back to another episode of the Newbie Dentist Podcast. I'm your host, Dr. Omid Azami. I must apologize for the poor sound quality on the introduction here today. I'm just returning back to Australia from a crazy 10 days in the United States. I'm currently in Seattle at an airport hotel, just recording this on my iPhone headphones here, so just bear with me. It's been a crazy last few weeks, and I do apologize for the long delay between the episodes. The past month or so has been really career-defining for me. I applied for and was lucky enough to get into a very competitive oral maxillofacial internship or resident year. This one-year program is at the Royal Dental Hospital in Melbourne and is essentially a gateway for getting into the OMFS training program. So accepting this position, meant that I had to kind of resign from my other jobs in private practice. And as any of you who have done that can attest to, it can be pretty stressful. So anyways, I'm beyond excited for this year of surgical training, and we'll see where life kind of leads from there. I'm not sure if, where or how I'll get into an actual training program or whether or not I'll pursue it, but I think this 1 year of surgical training is going to be really a good foundation for me to kind of make that decision based out of. I've been in the U.S. for the past week. I was in Seattle to attend the Coyce Center for Treatment Planning and Occlusion, which was amazing and kind of life-changing, to be honest. I don't want to overhype it, but it is that good. And then I'd headed down to Scottsdale, Arizona for the DIA conference, which was just a ton of fun. I got to meet a lot of the people I kind of look up to, a lot of the young dentists. SF Dental Nerd, Bloody Tooth Guy, Dr. David Attia was there, Dr. Paresh Shah, Sunny DMD, Phil Walton, so many guests and so many dentists that I've had on the show. Was able to meet in person there, which was a great experience. I won't get into that too much more. I will be doing a recap episode of DIA with Dr. David Attia, who was actually there with me, who attended there as well. And so we'll get into more detail with that in that episode. In this week's episode, I had the awesome pleasure of chatting with Dr. Misag Habibi. Misag is a dentist in Western Australia with an extensive focus on implant dentistry. Misag has completed postgraduate training in IV sedation and pain control, a Master's of Science in Oral Implantology, and is currently pursuing his PhD at the University of Western Australia. He is also the director of the Implant Institute, which we discussed in length during this interview. The Implant Institute is running a program starting in January 2020, so you got to sign up soon, guys, if you're interested, which is the first of its kind in Australia, a postgraduate certificate program in implant dentistry with an additional opportunity to extend that training for another year to continue on to obtain your postgrad diploma through Cambridge Academy of Dental Implantology. If you're interested, you got to act quick because these things are selling out very quickly and the deadline is approaching, so you can find all the details in the show notes below. This episode is brought to you by our good friends at Henry Schein. With over 60,000 products available from consumables, CAD/CAM technology, lab, and large equipment, you can always rely on them to be your trusted business partner every step of the way. As always, if you guys are enjoying these episodes, please help me out and head over to iTunes and give the show a 5-star rating. It really does help with the algorithms and helps the show get more exposure so it can reach out to more people and help more people that way as well. Also, I just want to thank everyone who has pre-ordered their copy of our Foresight Dental Journal. This joint initiative with Dr. David Keir has been met with so much positivity, and we're really excited to get these journals into the hands of as many dental students and dentists out there. Head over to Foresight Dental, that's the number 4, SIGHT Dental, on Instagram or foresightdental.com for more information. Without further delay, I hope you guys enjoy this amazing interview with Dr. Misag Habibi.
Hello and welcome to the Newbie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Newbie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
All right, so I'm here with Dr. Misag Habibi, who is a very accomplished surgical implant dentist in Perth, Australia. He runs the Complete Implant and Sedation Dentistry, and I actually had the pleasure of meeting you a few weeks ago at Dr. Alex Fibushenko's implant residency, which was pretty cool to see. And obviously, for me, a lot of the stuff was over my head, looking at zygomas and stuff when I haven't even placed my first implant. But seeing how engaged you guys were and how much there is to learn really was pretty cool and eye-opening for me. So I'm excited to kind of dive into some dental implant education with you today. But normally how we start these things off is a bit of an origin story. So I know we're both Persians, so we have kind of similar backgrounds with immigrants and everything. But if you can just kind of take me back, tell me about your childhood a little bit, and then why you kind of got into that dentistry as a career choice, and then we'll take things from there.
Yeah. So how long have you got?
We got time.
Yeah. Look. Yeah, you're right. I mean, like yourself, Persian background, and I was born in Iran, and my family actually fled Iran as refugees when I was 6 years old. And obviously, for my parents, that would have been a very daunting and uncertain experience, uncertain times. And I guess, as with the story of many migrant families, especially refugees, it's a lot of sacrifice that they're putting in, a lot of uncertainty and fear and anxiety in terms of potentially providing opportunities for their kids. So, of course, I didn't have a great deal of understanding of what was happening. And, your parents try to protect you from some of the dangers that might be around you. But yeah, we got out of there with probably a couple of pots and a couple of blankets. And we're refugees in Pakistan. And eventually we were processed through Austria.
Wow.
And then settled in the United States. And that's hence my global, international, and confusing accent.
Yeah.
And we've had chats. We've had a couple of chats about the basketball, and that's where my big fandom of the Dallas Mavericks comes from.
That's awesome, man. I think the Mavericks have a pretty cool place for me as well. 2011 was like a pretty interesting year. It was the year I graduated from like undergrad. So I was staying for like my med school and down school exams and stuff. And that was the summer that, they beat Miami, and just like, it was like a really good summer. That's the summer I actually met my wife as well. So that run that they had, it was like so
good times for you.
Unexpected, but it was just like a great summer. I remember we used to get together with my friends and we just hang out and like after studying and just watch the games and everything. So
they were good games.
So I've always had a soft spot for the Mavs and seeing them now, like we talked about with like Luka and all that. And you just beat the Raptors recently as well. So
yeah, I watched that. Yeah.
But it's nice to watch, man. So that's pretty cool that you ended up in. So how long were you in Dallas for before you, like, obviously moving to Australia and stuff eventually?
Yeah, so we lived there for about 4 years, and by the time I was 11 years old, actually on my 11th birthday, we arrived in Australia. And this was as normal migrants now.
Yeah.
My parents just decided that Australia was maybe a better family environment and things like that. And so on my 11th birthday, I arrived here. By now, I'd mastered several languages, all of which I've forgotten. And then really, even though my accent may sort of make you think otherwise, really have grown up most of my life in Australia, and most of my experience has been an Australian experience.
Yeah. So what about, so when did the dentistry come into it? I know probably when you were going through as an undergrad model, so you would go straight from high school, is that right?
That's right, yeah. When I was going through in Perth for the University of Western Australia, entry was through studying a year of science. So academic entry into science was not particularly, competitive, or it was not at the highest level. But then you had to perform at a high level in the first year of science to apply for dentistry.
Yeah.
And I used to do a lot of different things. You talk about, before we started, I think you said my voice suited for the radio and that sort of thing. I used to do a little bit of acting and things like that back in those days. Nice. So some of my academic friends, would think that I wasn't as dedicated to the studies as they were. And hence, as a result, I only got into dentistry on the second round.
Yeah.
And I remember clearly walking into the classroom, and some of my good friends now that I remember already sitting down there a few days more experienced in dentistry than I was. But I guess my interest in dentistry really started, I actually remember I was around year 11.
Yeah.
And, when you're growing up, my daughter now is facing some of the same questions, like interested in lots of different things.
Yeah.
And I felt, I want to help people. I want to do that in a very pragmatic sort of day-to-day real level. And I want to work with my hands, because I was always, interested in artistic things. And dentistry seemed a really good marriage of those things, especially considering that you had this potential autonomy when you graduated to sort of make your own path and maybe make different decisions in terms of where you want your career. And I remember the day I mentioned to my year 11 physics teacher that I think I wanted to be a dentist.
Yeah.
And his response was, "You won't get into dentistry." Mr. Scott, if he's a member of your podcast,
we'll track him down for you. That's cool though. I think sometimes you need the doubters to kind of motivate you to be like, I'll prove you wrong, I'll show you.
Well, I went to quite a non-academic school.
Yeah.
And I think when you had academic ambition, especially if you tended to, be a bit of a jokester, which I was at the time, they didn't realize that maybe you had the capacity to apply yourself.
Yeah. That's awesome. So looking back now, so say if I knew you in dental school, if we were friends in dental school, what would I have said about you? Would I have anticipated that you go such an academic route into teaching and so surgical focus? Or were you maybe like at some points, okay, no, I want to be like more of a business person and have a couple of practices or into aesthetics or even then, like if I was sitting with you in clinic or over lunch in like final year dental school, I would have been like, you were talking only surgery to me.
Interestingly, I didn't have a clear path planned out for myself at all at that point. But my strongest subjects, those are only rudimentary, skills you're developing at that time. But my strongest subjects were oral surgery and fixed prosthodontics. Yeah. So maybe it was a bit of an omen that ended up becoming sort of the path that I followed. I think, what would you have said? I think hopefully I was okay to hang around with. Tried not to take myself too seriously. Sometimes those environments, I don't know what it's like with the younger generation now, but people could be quite competitive and even the environment of the dental school, sometimes, there's tensions and there's egos and, unfortunately these things still happen in our community sometimes, but I really tried to steer clear of those things. I tried not to be noticed too much by the staff, by the academic staff, and to just do the work I needed to do. But I really did enjoy dentistry right from the outset. And right from the outset, I was really interested in doing these reconstructive cases and doing extractions and fixed pros. And I think also even having a couple of the tutors at the school helped me through a couple of those cases. That I managed to do a couple of cases of VDO cases and things like that during dental school. Yeah. It did make me feel a bit more competent to take on those early cases when I had graduated.
That's great. And what was it like when you graduated? What was like your first couple of years out of school? What kind of roles were you in as an associate? What kind of jobs were you doing?
I actually, by this time, I did know that I was quite interested in honing my surgical skills or surgical aspect of dentistry. Mm-hmm. So I decided to move to a private practice in the country. There's a little country town in the southwest of WA in the wheat belt called Katanning.
Yeah,
a center for sheep and an abattoir and a very large metal slide, which I'm sure would not pass safety regulations these days, but that apparently was
that was the draw for the town
or something. What's that?
That was the main draw for the town.
that was it. We had there was a cafe called Phyllis's Cafe, and I think there was a Chinese restaurant there as well.
Yeah,
but I went to practice my first year in the country, and so it did give me an opportunity to get involved maybe with a little bit of trauma sometimes that presented at the hospital, acute infections with sort of inflammatory edema and trismus and things like that often here might present to a hospital.
Yeah.
That you'd have to manage, or you'd get called into the hospital to see if you could help out. And I had a colleague that, would do wisdom teeth cases and things, and I got a bit of early mentorship from him. I remember my first wisdom tooth case went quite well, but by the time it was time to close the flap, I was so mentally and physically spent that my needle holders, my hand was just shaking. And it's like I felt like I had done the job.
Yeah,
it was stressful, and now I had to close it up, and I was sort of spent. So that was my very first case. He came in and sutured it for me.
That's interesting. That's funny with suturing. Even now, because I find if you're doing like an extraction, it's just such a different motor skill of, unless you're doing like a clean sectional or something. But if you're like taking a forcep to like a molar and or premolar, like your hands like cramping up by the time you want to do the suture, that fine motor, like it is
Right,
it is that weird sensation. It's such a bit of a challenger.
Yeah, you'll get to the stage where suturing becomes so second nature.
Yeah,
you sort of, your hands just move and you don't know what they're doing.
Yeah. That's great. So when did the academic side of things come? At what point in your early career were you saying, okay, maybe I know enough now that I know that I don't know enough and I need to actually really dive into this stuff to call myself like an implant dentist or a general dentist with like a focus on surgical or oral surgery. When did that kind of come into play for you?
To be honest with you, the more I've gone along, the more I feel that how little I know.
Yeah.
As with anything, really. I mean, you know, that concept of imposter syndrome and all of that. Yeah. You go through these stages in your career. But, you know, the idea of learning more, progressing in skills, and applying more complex cases for patients and achieving better outcomes for them, these things always motivated me very much right from the outset. And a couple of turns that my career took probably was one, the fact that I really wanted to learn those things, but the other was I had a bit of a back injury. Okay. And I decided at that stage that what if I can't really spend a lot of time doing dentistry? Yeah. So I did the diploma of sedation at Sydney University, thinking that I may be sitting alongside dentists who are doing procedures for the rest of my career with how my back was at the time. So that's sort of where the journey of doing some post-grad stuff started. Mm-hmm. As it happens, it became a great adjunct in my daily practice.
Yeah.
And then later I went to different implant courses, and because of the surgical sort of background that I had, by this stage I was doing mainly wisdom teeth for large practices, a couple of different large practices and groups. What I learned in implant training, I had the opportunity to sort of start to actually apply. It wasn't so far out of my realm of thinking or capacity, step by step, of course. And then later on, after I was practicing implant dentistry pretty exclusively for some years, I thought it would be great to really get a bit more of a grounding in this profession. And that's when I did my master's at Goethe University.
Yeah.
And why I'm doing a PhD at the moment, I don't know. It's probably a lack of sanity.
That's great. So one of the things that I'm always really interested in, especially when I speak to someone who, you know, be it within business, they've opened multiple practices, or be it they're like a master clinician of one thing, just like aesthetic dentistry or an academic route. I think for me, what I find is it's so easy just to, you know, you go to work and then you come home and okay, I'll just watch some TV or watch some basketball, or just, it's hard to stay motivated to always be like, I want to keep progressing in my career. So when I get the opportunity to speak to people like yourself who've actually like not done that and have actually like kept progressing and kept pushing, and is what's the driving force? How do you like motivate yourself? How did you want to take that responsibility and not want to fall into a comfort zone? Because I think a lot of young dentists as well, we do a few wisdom teeth and it's like super stressful, or sometimes it doesn't go super well, and we're like, okay, maybe I'll just ease off that, and then they'll fall off and they just stop doing wisdom teeth, or they'll stop doing molar endo, and they just like that nice, comfortable, stress-free, and they're pretty much just doing simple fillings and stuff after a few years. So I'm interested in that other branch of people who say, no, I want to keep pushing myself, putting myself in like uncomfortable situations and learning and growing, and see like what kind of drove you to keep going like that.
I think it's probably a different balance for everybody in a way. I mean, there will be people in any profession that have different levels of drive to learn or to extend themselves. And you know what I love, probably a bit of a tangent here, but what I love about modern dentistry is that there does seem to be a path for increasing your skills and your knowledge in ways that you can help patients in so many different ways now.
Yeah.
So, you know, maybe you notice that your skills are surgically oriented, or maybe they're of a sort of diagnostic nature, or, you know, maybe you develop an interest in, sleep medicine, or facial development or aesthetics, and these days airways are a big thing. So I feel like there is a path for everybody. But what was your original question?
It's pretty much just, what do you think, or I mean, you've been around some other people who've done a lot of great things as well. As what common trends are you seeing in people who would like to keep pushing themselves and don't want to just stay average or just stay doing the same thing for their whole career and want to just keep adding procedures or adding more complex things?
I think it's just a natural drive to push yourself, to excel, to become better at things. I mean, I always have a feeling that to achieve excellence, that to be the best that you can be at something, and the way that we can help our patients, that in itself is a really motivating factor.
Yeah.
And it's a sort of profession where you can't be asleep at the wheel for too long.
That's the big one.
You sort of lean back for a bit and you go, wow, there's new knowledge and new skills that I need to upskill with, or to learn, or to read more about, because things are always moving so fast.
Mm-hmm.
I don't think for me, the challenge is sort of the other side, to be honest, is to know when to stop, to be more moderate, but I think some people probably just have that drive to learn more. But I see the profession as a whole sort of going more in that direction.
Mm-hmm.
You might see that more with a lot of your colleagues.
I think it might be a function of just competition, really. With more dentists around, one is obviously you want to be good at your job, but also if there's going to be 5 dentists in a given 5-kilometer radius, the better dentist will eventually rise to the top, and just patients will be like, well, he does better work, he knows more, he can offer more services. So I think
you've got to have your point of difference.
Yeah, that's right. So I think that natural competition is really helping raise the floor of dentistry a lot. Now on the other flip side, with like a lot of corporates and stuff, and like time pressures and things like that, fees going down, that's like the weird tough balancing act of, can you do good dentistry but also maintain the quality of it? And
that's a challenge. I mean, I always felt I didn't want to be involved in the sort of the corporate side or preferred provider programs and things like that. That's not in no way a judgment of people who are. I mean, there are definitely great dentists in those spheres as well. But certainly, I feel maintaining your independence does give you a little bit more opportunity to invest in your career and spend the time with patients that you need to sort of give those types of services.
Yeah. Okay. So tell me a little bit about, I guess we will talk about like implants, and you're running the Implant Institute, which is I think it's like the first of its kind, coming up with like an actual certificate degree coming up in Australia. So we'll start with that first. But so run me through the curriculum, what the course entails, and what value you think it can have for like a lot of young dentists coming up that haven't actually started placing the implants and pretty much want to start an implant pathway from scratch.
Sure.
That'd be great.
Yeah. Look, to give a little bit of background, I guess, there's a lot of different training opportunities around. And myself, I used to run an training institute called the Dental Implant Education and Training Institute, because I like really long names. And for a number of years, we would do, multiple modules throughout a year. And I'd have a good group going through with me every year, usually younger dentists, sometimes older dentists as well. And it was sort of, it became apparent to me that no matter how well you educate or try to educate a group of people, unless there's some type of immersion and dedication to learning the skills or extending yourself academically in that discipline, it's very limiting, And I know that people that did those courses, I'm sure they got things out of it, and it's been nice to get good reviews from those courses. But at the end, I don't think they really extend people to the level that they're able to go. What's really exciting about this postgraduate certificate program that we're offering is that over the span of a year, someone with no experience or little or moderate levels of experience can really, in their own time, dedicate themselves to really delving into some of the fundamental theory and academics of implant dentistry, being involved in academic discussions, and requirements. Then going into module 2, gaining maybe practical skills and tips, and whether treatment planning or with manual skills that they didn't have previously. And then finally, putting that into action in actual case, carrying out cases with patients, but not doing this in an isolated fashion, but having mentors that work with them closely to make sure that they're expecting of themselves the sort of quality that they're capable of achieving. I think the main difference of this program and maybe others is that you can go in and get an immersion in something and then go back.
Yeah.
And you don't really have a great sense of judging your own standards because you're sort of on your own. Whereas here, you can go along a path, with the mentorship and the supervision that those cases entail. So I think it's a great course we've got some experienced people enroll because I think it's a great opportunity to, do a consolidated program, get an actual academic award out of it, a postgraduate certificate, continue to a postgraduate diploma the following year. But it's certainly very tailored for absolute beginners to be able to take that journey in a methodical and practical and moderate way. Not throwing yourself in too early or too deep, and at the same time, not being so left at such a distance from the actual day-to-day of implant dentistry that you never end up practicing it.
I think that's a great approach. So how the year's laid out is the initial didactic period online. Is that right? So you just go through the base curriculum and then you come and spend time with you actually in Perth. And is there some hands-on components and things to actually get some of those skills? And then once that's done, then there'll be a period where you can, on your own patients in your own practice with supervision from the local mentors and things, actually place some implants. Is that how the year kind of runs?
That's it in a nutshell. You're better at saying it briefly and properly than I am. But that's exactly it. And it's actually a program that's been running, or a variation of the program that's been running for about 10 years by the Cambridge Academy of Dental Implantology in the UK. And Dr. Stuart Ellis is the director of the Cambridge Academy. And basically, we're collaborating. I'm the Australian program director, and it's a collaboration of the Cambridge Academy with the Implant Institute here. So all of the online curriculum is very thoroughly developed, and the requirements and assessments and things that need to be met are comprehensively developed in a manner that allows that program to receive the accreditation for a postgraduate certificate that it has, and then postgraduate diploma as well in the UK. Yeah. What we're then able to do after the delivery of that online content is to then do the hands-on here, which we're delivering in Perth, the practical skills, and then in all locations around Australia, the supervised clinical cases. Yeah,
I think that's a great concept, and it's a really well laid out year. I think it's, like you said, the immersion is important. A lot of the other implant courses and stuff you see will be one of those elements, but not all of it kind of put together, right? You'll have, for example, I enrolled in Dental XP's online implant fellowship.
Right. Yeah.
And it was just it was 300 hours of videos. I'm like, it's nice to get some learning, but there's no follow through with afterwards. I have to enroll for the next thing. But I think if you have this nice curriculum laid out, start to finish, and someone who's I want to do implants can just actually sign up and just follow the steps and get through it, and know at the end of it that you will have had enough feedback and be involved. And I think the accountability is important too. I think that's one of the things, probably with something like this, where you're in it with maybe a smaller cohort of people going at the same time, you'll be like, what happened to your case? Are you not going to start placing implants? Or I think that accountability is a big driving force for a lot of us to actually just jump in and stop dabbing your toes in.
Exactly. It's with anything. I find when you have the requirement to do something, you'll find a way to do it. Yeah. If you don't have a requirement to research and read articles and contribute to an academic discussion or an essay, you're not going to do that.
Yeah. You might, but the average person.
The same way with clinical casework. When you have the requirements and you need to meet certain standards, and it needs to be supervised. I find, even sometimes experienced implant dentists, when they're able to have a mentor or discuss a case, they approach things in a different way. And I think that's a good message, I guess I could say, for all of us, but especially those who have had some preliminary implant experience. Maybe they've placed a handful or 20 or something like that. Mm. There's still, a huge realm of discovery, learning, and improvement that has to come from there. And that's where mentorship is important. At the Implant Institute, we offer mentorship possibilities for people after, those programs as well, because really to go to more advanced levels for people who wish to, I think that's really sort of indispensable.
And now a short ad break from our sponsors. Are you looking for a hands-on course to complement your current CPD plan? Henry Schein runs over 150 CPD courses every year. Visit their website at www.henryschein.com.au to review the current offering. Their complete offering ranges from endodontic, orthodontic, surgical, as well as infection control, and much more. Use the code PODCAST for a 5% discount on all Henry Schein run courses. Again, that's a 5% discount for all the Newbie Dentist listeners out there by using the promo code PODCAST. Head over to henryschein.com.au for more information.
Yeah, I think hands down, I've had the pleasure of interviewing a lot of high achieving dentists from around the world, and mentorship by far is number one commonality between everyone.
And that's a great thing that's actually available these days, in terms of having more people with expertise in the dental community and in the general dental community.
Yeah,
and also those who are willing to be involved in education, be generous with their knowledge and so on. I think, you guys have got it great. I'm not that old. I'm a little bit older than you, but when I was trying to learn these things, to try and find that was next to impossible. I had to certainly do a lot more traveling and a lot more self-driven learning than what people have the capacity to do now, and I think that's just really fantastic.
Yeah, and that's one thing we probably didn't mention when we were talking about how dentistry is growing so quickly in terms of the level of dentistry, is that access to knowledge. Just with social media, with online CPD courses, you can be at home after work or even between patients, or if you have a gap, patient has a no-show, and you can watch a lecture from Tarnow in the US or something. And it's just there, right? Absolutely. And you can just access it, which is pretty cool.
Absolutely.
So in putting this Implant Institute curriculum together, I'm sure you probably looked at other courses and stuff available. There's obviously a lot of competitors like Guide, and then obviously the university-based ones. What do you think the overall state of implant education is? And beyond that, in terms of implant success rates, I don't know this numbers off. I'm not one to read much literature, but I've heard from others that implant success rates are declining a little bit because a lot of inexperienced general dentists are doing it more compared to what the initial studies were based on just specialists doing them. So where do you think that's going to go forward in the next 5-10 years of more and more dentists doing implants? And is the education enough via CPD route, not formal university-based programs, to actually keep them to a level where it's sufficient or standard of care, I guess?
It's interesting. There's a couple of aspects to your question there. The part about our success rates declining because there's more people involved in implant dentistry and so on. I think in the literature, obviously there's a wide variety of things reported, and so much of it pertains to the conditions and the applications that involved in that study.
Yeah.
But certainly, as you open the door to more and more people doing something with a less trained and less thoughtful or methodical manner, then of course the likelihood for failures is higher. But I think a lot of it also comes down to the range of applications that we're able to do in implant dentistry, and the range of complexity of cases is higher and higher. At the same time, the technology, implant designs, understanding of hard and soft tissue requirements and considerations for long-term success have come a long way, even in the last few years.
Yeah.
So I'm not so familiar with sort of the side where things are failing more. I'm not sure. Maybe with tourism and that sort of thing, dental tourism.
Yeah.
But I see the standards going up,
Okay. That's good.
And it's interesting that what you ask about, whether that can be done sort of in industry type education or university based education and so on. I think the path is probably different for everybody, but a few years ago, I think there was a conception that if you were at a university specialty program, that's how you became knowledgeable or skilled. And if you were outside of that, maybe you were doing something you shouldn't be doing, or you were a bit of a cowboy and that sort of thing.
Yeah.
I think that perception is gradually changing with the quality of education and training that's around. And also a lot of people outside of the specialty programs that are really focused on implant dentistry, whether it's in clinical practice or in research and development and so on. So, I mean, I think it's exciting times, and there's so many paths, to achieving and learning. But, I think a program like this that has all these aspects welded together or melded together is a good pathway for a lot of people.
Okay.
I mean,
yeah,
I was just going to make comment about the in comparison with the different. You sort of asked,
Sure.
What do I think about the different types of programs that are out there and the competition that's there? I mean, recently I've been feeling there's it's almost an oversaturation in the market in this particular discipline. Yeah. A few years ago, you couldn't find anyone to teach you anything. And now, you look left and right and you'll trip over an implant program.
Yeah.
So I think it gives people opportunity to upskill in different ways. I'm a little bit cautious about programs that are really intensive, or say overseas you go and you do 10 sinus grafts and you come back.
Yeah.
And I sometimes have a chat with someone like that and they say, oh, but I don't need supervision because I did 10 sinus grafts in Inner Mongolia or something. And but as you discuss cases, or if you do mentor or supervise one of these colleagues there, you realize that they don't know yet what they don't know. Mm-hmm. So I think if we're knowing what to do with that knowledge, like if we're learning all the aspects, even on the academic side, but then upskilling in certain things, I think that's good. But throwing ourselves in the deep end and thinking that now we understand the discipline, I think is a little bit dangerous.
Yeah, that's tricky. And I think that's certainly what those there's like ethical things with those too, in terms of like follow-up care, you don't know, and like success rates and things like that as well. So yeah, while it might be kind of a fun way to kind of just go in and try something, I don't know, like if that's like not everyone will be comfortable doing that. I think like ethically or morally.
Yeah. Well, I think some people that really have their head around this sort of thing, and they're really extending their learning in lots of different ways, they can go and they can get certain skills. But people that are going in those paths to learn implants, I think maybe that's not the ideal way.
Yeah, for sure. So in terms of this course coming up, is this something that you're going to run annually, or is it like a 2-year cycle because of how do you foresee it growing in the next couple of years?
We definitely are running the postgraduate certificate at least every 2 years.
Okay.
But based on sort of interest generated, I'm pretty confident that we'll also, as well as 2020, we'll run the postgraduate certificate probably in 2021 as well.
Okay.
Certainly we will be, we plan to progress into year 2 of a postgraduate diploma for the portion of students from the postgraduate certificate that wish to continue their studies. And I know especially several of the more experienced delegates, they already have that in mind, that they're definitely going to do the postgraduate diploma. Yeah. And in fact, they're doing the certificate because they know it's the first year of the program.
Yeah.
But I hope that, in 2021, we'll be offering both programs.
Okay. Because I'm asking partially selfishly because I want to do it hopefully the following year. I want to make sure it's actually available. So
yeah, hopefully we'll be.
Yeah. Awesome, man. Thank you so much for coming on. I know we trying to squeeze a lot of stuff into a briefer amount of time. and kind of develop a few thoughts and things like that. But I think you provide a lot of great things for the young guys like dentists listening to kind of consider. One last thing I'll ask you before we jump into like a quick kind of rapid fire to wrap things up is, in terms of general advice. So if you're talking to me or another young dentist who enjoys surgery as like a thing that they like doing in dentistry. They've done a bit of everything now. They've been working for a couple of years and they want to really get into the surgical realm, implants, wisdom teeth, soft tissue stuff. Where do you think is the best place to start? Is it, especially if they're an associate, because if their boss is not doing that stuff necessarily, it's tough to kind of come back from a course and implement these things because there's not that support system in place. What would you recommend to someone, or even if going back and giving yourself that advice when you're 2-3 years out to like get to where you want to get to a little bit faster, what would you say?
On the surgical aspect of implant dentistry? I guess, in my path, I was a little bit fortunate in that regard because I had sort of developed some skills in the country on the surgical extraction side of things and all of that. And then I managed to work for large practices that could use that skill set, and I could keep developing that skill set. So by the time implants came around, it was a natural progression. I don't know. It's a little bit difficult to think how without some sort of getting your hands wet on the surgical side of things, or being clean with raising flaps, and having raised a lot of flaps, being clean with your basic interrupted suturing techniques and, basic tension-free flap closures and things like that, how you could jump into implants and do it well, I do see that happening a little bit. And when you said sometimes, do we get more failures? And that probably if people are just jumping in thinking that you don't need to be good at that other stuff, you would. So I think maybe the idea of mentorship, having someone around that does have that skill set really comes into play. And hands-on courses where you can develop those skills. So, you might want to develop certain surgical skills at a course and then go back and gradually introduce them to different aspects of your treatment. But it's something that just keeps needing revisiting.
So I think like learn to walk before you run type thing. Get the surgical principles down right. It's, at the Alex Fibushenko residency that we're at, I mean, obviously for me, I wasn't really getting too much from the zygoma placements and how he was, doing the osteotomies for the sinus. But for me, what I was seeing,
he's very good at that.
What I kind of gathered from at my level of just doing surgicals and wisdom teeth and stuff is just how clean he was with his surgical principles. So that's when I was trying to kind of watch him and see how he's doing, how he's closing. And so I think that's like the foundation you got to get really down right before you start adding those services and things
I think what you said is really good. Like you might be starting with simpler procedures, basic flaps, basic mucoperiosteal flaps for a surgical removal. By the way, when you get deeply into implant dentistry, you'll never do a surgical removal again. But,
minimally invasive,
But if you can close those flaps and everything looks clean and beautiful and not traumatized, there's no tension, there's no edges that are slightly pulled this way or that way. Then you're expecting a high standard of yourself, and those things become much more a requirement when it comes to implant dentistry, especially when you get into grafting procedures. The slightest suture line opening or a bit of tension and everything fails. So just being aware that standard is high that you set for yourself, then you can work towards that.
That's great.
But that was a good program, and you were able to observe how cleanly something even complicated can be done.
Yeah, no, that was super impressive. And just seeing his speed and efficiency and just there's no wasted motion with him. He's done it so many times, the reps are there, right? So it's like done. Everything's
that's right.
Laid out pretty well. Awesome. So I would like to wrap these up with a bit of a rapid fire. So let's jump into that. So what's your favorite pizza topping?
Pizza topping. Well, it would be pepperoni, but I've been vegetarian for about 4 months.
Oh, no way. I just started that as well. I'm like, three months in now.
Oh, well, there you go. I've broken a couple of times. I'm not going to be, fanatic about it. But for the most part,
moderation. But
So what would it be now? Gosh, chili never goes. Chili is always good, and probably mushrooms, sun-dried tomatoes, and avocado.
Avocado, nice. What's your favorite musician, or artist, or a band?
This is where my age will really Sure. Well, I've always enjoyed all sorts of music, but probably when I was your age, I was very much into the R&B and hip hop scene.
Yeah.
And I still like some of the old school hip hop, like Beastie Boys,
Oh yeah.
Public Enemy,
Okay, cool.
even a bit of Run DMC maybe.
Yeah.
But now I just enjoy a little bit of everything. Some of the old stuff I listen to, I cringe. And
Yeah.
I don't know why I like that. But maybe a little bit of alternative, I would say.
Yeah. And what do you listen to at work? Especially obviously if you're doing sedation, so you probably have a little bit more freedom of what you listen to.
That's true. It's great having a sedation focused and surgery focused practice because you can have music on and you can have good conversations amongst yourself. But it's always just, relaxing music. So it could be a little bit of soul or, I'm not there to be entertained. I want it to be calming.
And just
a little bit of Nora Jones, maybe a little bit of classical.
Nice. A little bit of jazz. Yeah.
Jazz. I do listen to a lot of jazz at work.
That's great. And what's I guess for you, since you're doing implants, what's your favorite tooth to replace with an implant?
Central incisor.
Challenging. That was Dr. Fibushenko's answer as well. So that's good.
Yeah. I mean, look, if you're talking about single teeth, obviously the most impactful and, and if you can create that soft tissue harmony and symmetry and peri-implant health, it's always satisfying.
Yeah, good, nice and challenging. If you weren't in dentistry, what career would you be in?
Ooh, I told you before we started, I think I used to want to be a game show host when I was younger. Yeah. If it wasn't dentistry, I'd probably be somewhere in either the arts or political science.
Interesting. It's a big, wide spectrum there. And what's one procedure in dentistry that kind of makes you question your career choice?
Well, luckily, I don't do a lot of procedures that I'm mainly focused on implant dentistry. But you mentioned molar RCTs before.
Yeah.
I'm pretty sure I wouldn't be the best at the world at them. So.
Awesome, Mr. Thank you so much for coming on. It was great to have some time with you and chat about your journey and everything you're doing with dentistry.
Fantastic! It was great talking with you.
Yeah,
you probably want the listeners to know that I did
have the
deck
Dallas
out
Mavericks
with my Dallas Mavericks jersey and hat because you said it was only going to be audio. So
yeah, for sure. So they've missed out. So I'll put
really nice talking to you.
I'll put the show in the show notes the links to the Implant Institute course and everything and yeah, hopefully you do run it again in the next cycle, so I can hopefully enroll and
for sure. And I mean, when they get that link, I mean, it's not just a postgrad certificate, but there's more advanced weekend courses and things like grafting and immediate implants, and we have an all-on-X residency later in the year for more advanced practitioners. So there's a little bit of something there for everybody.